Welcome, everyone, and thank you for being with us. We're going to talk about the power of data, applying analytics and AI to transform healthcare. It's my pleasure to welcome Connor Bagnell, Senior Vice President for Product Management and Strategic Alliances at MCG Health. First of all, Connor, welcome.
Thank you. It's good to be with you.
Great. Thank you. Uh, could you introduce yourself briefly to the audience? Tell us about your role. And if you could share a little bit about MCG Health, since I think some in the audience will not be familiar with some of the recent changes at your organization.
Sure. Yeah. So as you mentioned, I am the Senior Vice President of Product Management at MCG Health. MCG Health started in the late 80s, early 90s as part of Milliman, the actuarial consulting company, where we were a division called the Milliman Care Guidelines. In late 2012, we left Milliman and joined Hearst and really were the catalyst for the creation of Hearst Health, which is a collection of healthcare focused organizations within Hearst.
Wonderful. I think you'll be able to offer us some really interesting perspectives on this subject. So great to have you.
Thank you.
Sure. So we've been talking in some of our recent sessions about the landscape around advanced analytics and AI and machine learning in the current operating environment in healthcare. It's very complex, as everyone knows. Organizations are really kind of dipping their toes into the water, trying to figure out where they can start without, to add to my aquatic uh, uh, analogies, without boiling the ocean. And one of the challenges is that there are many possible directions that an organization could take in trying to apply AI and machine learning. I have been covering personally for the magazine the application of AI in such areas as revenue cycle management, clinical transformation, and I just wrote about it last week in the context of radiology and imaging. And even there, it's complex because it can be diagnostics, workflow, et cetera, and quality assurance, among other areas. Starting at 40,000 feet, and then we'll dive down in segments of 5 or 10,000. What does the overall landscape look to you right now in terms of advanced analytics and AI and machine learning?
Yeah, it's actually it's a very exciting time in healthcare around AI machine learning. I think over the last couple of years in particular, I think we've seen a huge evolution in terms of the thought process around what's possible with AI machine learning. I would say 2, 3 years ago, when we were starting our journey with building solutions around AI machine learning, you would run into a lot of anxiety. So we'd work with clinical staff, nursing case management, utilization management teams, and straight away you could sort of see the antenna or the red flags go up in people's mind when you talked about AI machine learning, because people are afraid of losing team members. We're going to have to become more efficient, and that means people are going to lose their jobs. I think a lot of what's happened since COVID and the subsequent pressures that teams are under has really changed the conversation. Staffing issues have become really acute. People are looking for solutions that can be more efficient. And I think it's, for a lot of people, it's such an acute issue that even just keeping your team's head above water becomes the rallying cry. And so there's a lot of possibility in terms of what you can do with AI machine learning. I think there's some things to be careful with as you think about that too. We have a lot of data, and data is really the input that you need to be able to build AI machine learning tools. The challenge is that data is built off processes that people run today. So it's got all of the biases, inequities that we have in our current processes. And so as you're going in and looking at these tools, you've got to be very careful about what problems you try to solve and how to solve them.
Yeah. One of the things to me that's fascinating is this question of, again, on the one hand, you don't want to boil the ocean. On the other hand, you can get too micro, right? You can
Mhm.
solve a teensy weensy problem that doesn't really help anyone. How how are the leaders of patient care organizations that are doing this right? How are they kind of like cutting the meat, right? Like how are they determining scope and feasibility? What is the right process as you consider applying advanced analytics?
Yeah, yeah, that's a great question, and I think the metaphor is perfect, right? The amount of energy it takes to boil an ocean versus enough water for a cup of tea or coffee is vastly different, right? And so what you really want to be doing as you're looking at this is identifying problems
Yeah,
that are well defined, um, well understood in terms of the bounds of the problem. If you have a problem that people are doing repetitive work that is
yeah,
not very high value added, that's a great potential for AI machine learning.
yeah.
And so you're looking for that cup of tea or kettle to tackle.
Yes, absolutely. And so what are the that process of thinking through what processes might be uh, easily or might be fertile ground for AI? What are the smart patient care organization leaders doing? How are they working through these processes? Because one of the things that has really struck me in the last few months, I was just at RSNA in Chicago the week after Thanksgiving, and everyone's just kind of like lunging at this, right? They're like, oh, well, maybe we'll try this, maybe we'll try that. It seems like there should be a really good governance process for this, and that one needs to get the right people around the table. And sometimes it's hard to even know, who the right people are because you have to figure out what it is you might want to do, right? What are the smart patient care organization leaders doing in that governance process to determine the fertile areas?
Yeah. So I think one example. So as we started to do this, as we approached it, I can share our thought process.
Yeah, yeah, please
So
do.
so the first thing that we wanted to make sure, and we knew this was a learning experience as well in many ways. So for the first time you do something like this, you know that there's a lot of things that you don't know. So the first thing you want to think about is when you're tackling a problem, what's the risk of getting it wrong? So as we think about evidence-based guidelines and clinicians making decisions based on evidence, it's incredibly important for us not to have the wrong answer, because the wrong answer can end up with the patient not receiving the care that they need, or receiving the wrong care. So automating decisions or using AI machine learning to help automate decisions about what a patient should have is not the first problem we wanted to tackle. So we thought about it, and we actually went out and spent time with customers, understanding their operations, understanding the areas that they were struggling. And one of the areas that we noticed, and many people who work in provider and payer organizations will see this, the Monday morning after a weekend, from a utilization review perspective, can be a nightmare. All the cases that came into the hospital over the weekend have to be dispositioned. You have to communicate with the different stakeholders. You have to communicate the admissions, the decisions. If there's questions, you're communicating back and forth. So we could see a big problem there. And you would talk to case managers that knew Monday, Tuesday were going to be a nightmare. They're not going to get through their whole workload. There's cases that they don't get to in time. And when you don't get to it in time, that can be a payment issue. So we thought, okay, there's something interesting there. So there's an acute problem
Yeah,
that people want to solve. There's data that can likely be used to help with that. And so our team was able to take the information about how people use our guidelines in general, about what's happening operationally within the hospital, and we could produce a predictive model that predicted the probability of the patient being in the correct status. So, for example, an observation patient with a working diagnosis of bacteremia has a 70% chance that that's actually inpatient versus a chest pain patient who's been admitted into inpatient. We know from our data that they have a 4% chance of actually being appropriate for inpatient. And so if you take that and multiply that by the cost of that decision being wrong, you can actually create a prioritization um, mechanism for the case managers where the very first case is the highest um, priority and the highest potential benefit in doing the review. And so when you have a problem and it's very well defined, well understood, and you've got the data that help you get your hands around it, you can actually produce something that becomes very interesting.
Okay, good,
And we've
good. And do you, as as organizations plunge in here, um, I'd like to get at the question of, and of course it depends on the specific problem set that you're looking at, but who needs to be around the table? And let's focus on clinical issues.
Mhm.
I mean, clearly you need senior clinician leaders. One of the things that we've been talking about at our events is this terrible shortage of data scientists, and even kind of like advanced data analysts. Uh, so if we say in ABC Memorial Hospital, well, we need to get everybody together around the table, but you may actually have some people who don't exist, right? That could really help. How do we, you know, and sometimes you need external help, like from an organization like yours. How do we figure out who the right people are, and that whether we have the right skill sets to do this?
Yeah. So I think you're absolutely right. So senior clinical leadership is really important. I think you do need a certain level of expertise.
Mhm.
Um, it may be actuaries, it may be data scientists, but you need someone who can understand the data. And you also need someone at the table who's also thinking about the risks, right? So
Yeah,
if you're producing an AI solution based on data and you're generating results and you can't really explain or understand the results, that's a risk, right? So if you start making decisions based on these models and you're not able to explain unexpected outcomes, that's a big red flag. So you want to make sure you have people at the table who are asking those questions as well.
absolutely. So what is the next couple of years going to look like in this area? I sometimes talk in our summits and sessions about how I'm fascinated with the early days of the telephone and the automobile, right? Like people were trying to figure out what those inventions were for, right? I mean, it's funny in 2021 to think about it, like what's a phone for, or what's an automobile for? But early on, it was very difficult to figure out what features you wanted, how you wanted to build systems. The early cars were all custom made. People were putting the brakes in different places, the gas pedal in different places, the steering wheel in different places. And early phone systems were really complicated and they didn't know how to connect them. So, how will we evolve forward in the next couple of years in this area where we'll, develop some templates and case studies that work, right? And then people will learn from those. What will happen in that way?
Yeah, so I think, and actually the one you remind me of, I love the old quote from Henry Ford that he said, if I had have asked my customers what they wanted, they would have said a faster horse.
Yeah,
So
exactly.
it's hard to extrapolate where these solutions will solve problems, and I would say it's probably not all that useful to do that. Obviously, organizations need to have expertise along these areas. As you mentioned, when you're getting people around the table, you will need to have people who understand data science, who understand these analytics techniques. Um, I would say you should not be looking to them to figure out what problem to solve. So I would start from where are the acute problems and try and understand those and then understand the acute problems where you have repetitive processes with high value resources doing repetitive non-value add work. They're probably the biggest opportunities.
Yeah.
And so I think what you'll see over time is um, people will identify problems. They will focus on the data around the problems, understand how to solve it, and then find the next problem. And so it's a continuous improvement uh, type process versus, as you say, boiling the ocean. A solution in search of a problem rarely works out as well as people think they will. And it's funny, we see quite a few customers and we'll talk to them and the teams are saying, okay, we need an AI solution, and we'll say, okay, that's great, what do you need it to do? We don't know, we just know our leadership are asking us to get one. You've got to start with the problem you're trying to solve. That to me is key.
Yeah, absolutely. And what we just have a few minutes left, but let's ask about advice and maybe drill down a little bit on that. What are some of the couple few things that you would say that our viewers should think about as they move into this? A lot of what you said has been implicitly advice, but maybe
Mm.
let's get explicit about that.
Yeah, so I would say the first thing is understand your processes, understand the risks around equity and bias in these processes as
Yeah,
well. There's been some really good studies recently. Ziad Obermeyer in 2019 was able to do some research and identified real systematic lower risk health risks being identified for Black people, and that was
yeah,
based on models that were built on decisions that were being made in an inequitable environment.
yeah,
So you really do need to spend time to think about the potential risks. One of the underlying issues that they identified in that study is that they used a predictive model for financial risk, which actuaries do that all the time. I think the model was perfectly valid from that perspective, but
mm,
then they tried to use it as a proxy for health risk. And I
yeah,
think that's where some of the dangers are. So when you're building models, be very careful about taking something that's built for one purpose
yes,
and then using it for another purpose.
yes, yes. And what would your advice be as organization leaders are developing the models? Um, Obviously one can make mistakes. What are some of the lessons that you and your colleagues are learning about the best way to create the most uh, accurate or the most prediction worthy models?
Yeah, so one of the things that we found useful, especially early when we're testing ideas, is to form a red team. So you'll have a team of people who are building the solution, and they naturally become passionate about what they're doing and want to move it forward. It's sometimes helpful to have some smart people who are looking for reasons or ways that the solution is wrong. And so they can stress test the thinking. They can look for the things that people haven't really taken the time to think through. I think one of the things that you want to make sure you're spending time on is understanding when something is not coming out as expected. So you build a model, you think it's going to work a certain way. You spend time actually sitting, looking at how it's being used, where it's being used, and if there's anything that surprises you, that's a good opportunity to dig in and understand what is it that you didn't understand that caused you to miss something in your prediction.
Yeah.
And having those feedback loops, I think, can be really important.
Yeah. Are you on a kind of scale of 1 to 10 in terms of optimism, pessimism, with 10 being the highest and, pessimism, hopefully you don't want to jump off the top of a tall building. Where are you on that scale of 1 to 10 in terms of our moving forward as a health system with some alacrity in terms of applying AI and advanced analytics?
Yeah. So I would say in many ways this is kind of like the information age, the internet, where it starts, people get optimistic, and nobody quite has a real appreciation of what's possible. So I'm probably on the 7 or 8 on the scale in terms of the impact on healthcare. I also think it's very hard to predict what's going to happen. So I think I certainly don't expect a big boil the ocean, one solution solves all the analytics problems. I think what will be more likely is many organizations will find interesting and innovative ways to solve real discrete problems, and as those solutions build on each other, it accelerates the efficiencies and value that can be delivered in healthcare.
Yeah.
So I'm optimistic, and it'll be interesting to see how it evolves.
Yeah. I'm glad you're optimistic. I think if ever there were a time and a situation in which there's a burning platform for change, now is it.
Yeah, very much so. Very much so.
Any final thoughts?
Um, no, I think as we said, it's an interesting time. The technology is becoming cheaper and cheaper. I think
Yes.
the data that is available is just becoming vast. So the amount of potential is mushrooming every month, every week even. And I think if we're careful, we can do some very good things without having bad unintended consequences. And that's what we're very much committed to doing. And I think that's what we're seeing more and more organizations leaning into as well, which is exciting.
I think that's exactly right. And I feel optimistic too. We're in a complicated moment, but I also think that one of the great things about healthcare is there are so many smart, dedicated people and so many people who really do want to make a difference, not only in the lives of individual patients, but in the lives of communities and the entire country as a whole. And I see a great excitement and enthusiasm to move forward uh, in this area. So
Yeah, that's very well said. I think the most people who get into healthcare are doing it for very altruistic, good reasons, and they need help with better tools. So
absolutely.
I like that.
Yeah. Thank you so much. It's been great to speak with you, Connor, and really appreciate it. I've learned a lot, and I'm sure the rest of our audience has also.
Thank you. It was a pleasure talking to you. Have a good rest of your day.
You too. Thank you. Thank you to you and our audience who participated by viewing the session. This concludes the session. Have a great rest of your day.